Hey everyone, what's going on? It's Jason with Sineski with JW Senior Insurance coming at you with another video. And today's topic, we're going to talk about extra help with Medicare costs. And this is going to be specific to the state of New Jersey. Now, every state's going to have their own individual prescription assistance program known as an SPAP, which stands for State Pharmaceutical Assistance Program. But we're going to focus here on my home state of New Jersey and go over the programs that help with both prescription costs, and then we'll also get into the ones that help with other Medicare costs besides just prescriptions. So the first one, this is the one that allows you to make the most income out of all of them, is called Senior Gold. Okay, so Senior Gold is a program that helps with the cost of prescriptions. And we're going to go through an example, and I'm going to do the same example with the PAAD program, which is the next one down. So you can see the differences in how these programs work. Now, the key thing to remember with both of these programs, Senior Gold and PAAD, is you have to have a Medicare prescription coverage in order for this to work. So these programs do not stand alone. They work with a Medicare prescription program. So whether that's a Medicare Advantage plan that includes prescription drug coverage within the plan or a standalone Medicare drug plan, that plan has to pay first before Senior Gold or PAD will kick in. So it's still important of what plan you're choosing because you have to make sure that your prescription is on the plan's formulary or list of covered drugs. And of course, if you're a client of ours, we're going to do that right off the bat. We don't enroll anyone until we have confirmed that their medication is on the plan's list that we're considering. So we're going to do that first, and now we're going to see how this would work with Senior Gold. So let's say you have uh, Clover Health or Humana, and that's your Medicare Advantage plan. And you got three generic drugs that are zero copay, and then you have three name brand drugs that are all tier three. So let's say that's a $47 copay per month per drug. So in the beginning of the year, let's say you're somebody that unfortunately gets into that donut hole or coverage gap after about 4 months. You know who you are. Um, so in the beginning of the year, you have your copay. So let's say you add Senior Gold. So instead of having a $47 copay per drug, which comes out to, if you had three of them, that's $141 a month. If you have Senior Gold, you have a $15 copay plus 50% coinsurance of the remaining amount. So 47 minus $15 is 32. 50% of 32 is 16. So 15 plus 16 is 31. So instead of paying $47 per drug, you're paying $31 per drug. So that's $93 instead of 141. That's significant. Now, you still have that donut hole or coverage gap. However, when you get in there, the impact is not as great. So let's say that those $47 drugs, after 4 or 5 months, you exceed your Medicare prescription plan's threshold for the year, and now you're paying the 25% coinsurance for the drug during the donut hole. And let's say that comes up $200 a pop for those prescriptions. So that's $600 a month. But if you have Senior Gold, so $200 minus 15 is 185. Divide that by 2 because you're going to pay 50% of the remainder. So that's 92.50 plus 15. So that's 97.50. So that's going to be a little less than $300 a month instead of $600 a month when you get in that donor hole. So that's a big savings there. Now, this plan, the Senior Gold, doesn't pay any premiums or late enrollment penalties. So if your plan has a premium, you're still going to pay that premium. Now, let's say that you qualify, your income is a little less. Okay, so let's say you're in the PAAD income level. Because senior gold looks like it's 42,000 for singles, 51,000 between 42,142 and 51,142 if single, between 49,209 and 59,209 if married. So that's senior gold. So now let's take a look at PAD. PAD is if you're single, if your income is less than 42,142, or if it's less than 49,209 if you're married. So if you're on PAD, premiums are paid up to the state benchmark. Now, state benchmark, let's say it's 35 bucks a month is the state benchmark. So what that means is your prescription plan or Medicare Advantage plan's prescription portion can't exceed that amount, because if it does, you're going to pay the difference. So I'll give you two examples. AARP Premier PPO Medicare Advantage, $35 a month. United Healthcare AARP put all of the premium on the prescription side. So PAD picks all of it up. They had zero on the medical side. So if you have that plan, you pay zero per month for your plan because PAD will pick the whole thing up. Now, let's say if you have Humana Choice PPO 186, that plan is a $36 premium, and Humana put 35 on the prescription side and $1 on the medical side. You're going to pay $1 per month for that plan because PAD's going to pick up the prescription portion, but not the medical portion. So that's how that works in terms of premium. If you had a late enrollment penalty for Medicare drug coverage, PAD will pay your late enrollment penalty in addition to any prescription premium that you have in your plan. Deductibles, let's say your plan has a $505 deductible for prescription drugs. That is going to be irrelevant to you because your maximum copay on PAD is $7 for name brands. So in the same case that, let's say the person with a $47 copay that we took for Senior Gold, the three drugs, they're going to be $7 a month for a whole year. Even if that person gets in the donut hole or coverage gap, it's irrelevant. It's $7. If the person had a deductible on their drug plan, irrelevant. Max copay is $7. Only thing you got to pay attention to, like we said, make sure the plan that you have covers your prescription in terms of it's on their formulary or list of covered drugs. And like we've said before, we're going to do that for you for a client of ours. So we'll make sure that that your PAD or Senior Gold will coordinate with your plan, because we're going to make sure that your drugs are on the plan's list. So these two programs, this information is right off the Department of Human Services website for the state of New Jersey. We help all of our clients apply for these extra benefit programs for those of our clients that have limited incomes. We do that as a service at no cost to you. There's never a cost for our services. We are paid by the insurance companies that you enroll with. So there's no fee for our services to you. With these, we recommend doing paper applications because with Senior Gold and PAD, they don't ask for personal bank account information or asset information. And if you're doing an online application for these programs, the system is not going to let you proceed. That's a glitch in their system, is it won't let you proceed if you don't put that information in. And a lot of people that are applying for these types of programs, they're a little bit higher earners than people around the poverty level. They don't want to be divulging bank account information, to the government. So you don't have to put that stuff in there. So that's what we're going to do. We'll help you do the paper application. There's a checklist of things that you're going to need to submit to the state of New Jersey, like a photocopy of your Medicare card, your insurance plan card, your proof of residence. You need two two forms of proof of residence. We're gonna help you out with all that with that checklist. And some of you that did a tax return the previous year, you're gonna have to have a copy of the tax return that you send in. But we can send it in on your behalf. We can tell you how to do it yourself if you want. But that's how those programs work with your Medicare plans. So now the next subset of programs here um, are the New Jersey Medicare Savings Programs. So these are programs that um, help, they all help pay the Medicare Part B, as in boy premium. So the $164.90 a month that Medicare deducts for Medicare Part B, if you qualify for an NJ Save Medicare Savings Program, the state of New Jersey will pay your Medicare Part B premium for you. So the qualifying individual, they get their Medicare Part B premium paid for by the state of New Jersey. They don't get any help with Medicare deductibles, copays, or coinsurances. So if they're on original Medicare, they're still responsible for, the 20% that Medicare doesn't cover, or if they're on a Medicare Advantage plan, they're responsible for any Medicare Advantage Part C copays that are associated with their plan. But they will get help paying the Medicare Part B premium. They'll also automatically qualify for prescription assistance. They'll be assigned a federal limited income subsidy, which works very much like PAAD. It's just that you have asset requirements in addition to income requirements. So for the QI1 program, says here, so income 18,347 for singles is the max, 24,719 for married couples. Assets cannot exceed 8,400 for singles and 12,600 for married couples. The next one is called the Specified Low-Income Medicare Beneficiary, SLMB, SLMB. This program pays Medicare Part B premiums. It also pays, it has a spend down for it to cover Medicare copays and deductibles. You should probably still have a Medicare Advantage plan if you're a SLMB, because you have a certain spend down that if you have original Medicare, those can be some high out-of-pocket costs before the state comes in and pays. So you should probably get better primary insurance first. But the income for that one is 16,308 max for singles, 21,972 for married couples. Assets cannot exceed 8,400 for singles and 12,600 for married couples. The following one is QMB. Okay, so this is just one step above Medicaid. So this is a program that will pay the Part A and Part B premiums, deductibles, coinsurance, and copays. So if you're in original Medicare, you're not responsible for the 20%. If you're in a Medicare Advantage plan, you won't be responsible for your plan copays. The QMB will come in and help you with that. It just doesn't give you all the stuff that Medicaid would give you, like the state of New Jersey Medicaid, may have long-term care supports, dental and vision, other services not included in QMB. The QMB has a 13,590 max for singles, 18,310 for married couples. Assets cannot exceed 8,400 for singles and 12,600 for married couples. If you're below this, you're on Medicaid or QMB Plus. You're fully dual eligible. You'd be eligible for a DSNP program, where you can get a lot of extra benefits through a Medicare Special Needs Plan, or you get other benefits from the state of New Jersey as well. But the QMB, SLMB, and qualifying individual QI programs, you can apply online through the state's website. Now, if you're going for Medicaid or family care, I would suggest going to your local county social services to do that application, because that's going to be much more stringent requirements. But we wanted to go over this information here beyond just the insurances that we offer, to let you know about other programs that you may be eligible through government assistance based upon your income. There's also non-governmental assistance programs out there that are income-based for prescriptions through drug manufacturers, just private prescription assistance programs that may be out there. We're always willing to help you guys out with that as well. If you don't meet the requirements for these government assistance programs, there's still other extra help out there. And for more information on what we do on our services, visit www.jwseniorinsurance.com or give us a call, 609-496-8030. And we'll see you guys on the next one. Take care.